Good morning. How are you? Good Good morning, viewers, and welcome to another edition of sorry, just one of those mornings. Good morning, everyone. Good morning, viewers, and welcome to another edition of Cancer with Kakaki Cancer Awareness with Dr. Denise Ejo, the CEO of Comwood Cancer Foundation. It's a very nice morning, just one of those days when you start off in partnership with AIT. Today, we're going to be looking at developing and fostering equity on cancer care in Nigeria, and in the house, we've got a very special guest. But as we want to start this conversation, as I always say, it's very nice to see you, and thank you for coming back and joining us again as we talk about cancer in Nigeria. Firstly, let me just give some updates. Appendix Cancer Awareness Month is August, and August is recognized as the official Appendix Cancer Awareness Month to increase awareness of this rare cancer and the need for more research to discover new treatments with the hope of one day finding a cure. As we all know, cancer, we're still finding different cures, but we're getting there globally. And August 1st was the World Lung Cancer Day. I hope our viewers were able to engage with that and be part of the campaign across Nigeria. In the house today, so let's start our conversation. It's quite an interesting one today. And in the house, who have we got? Together we fight, together we win. Comwood Cancer Foundation is welcoming you back again for another edition. Who is in the house with us? Dr. Nwamaka Lasibikon. It's long. This is so long. Good morning.
That was a fair attempt. Nwamaka Lasibikon.
Lasibikon. Oh, that you see, the shade has always caused me problem. Awesome. Thank you. Good morning, Dr. Maka. You see, I always ask the question. It's one of the things I've learned. Always ask people to pronounce their names. So, Doc, good morning. For the purpose of this entire interview, you're going to be known as Dr. Maka. Please,
Absolutely. That's fine.
Allow me. Thank you. So let me introduce our doc. Our guest today, Dr. Maka, is a consultant radiation and oncology and clinical oncologist and director of oncology at the University of Nigeria Teaching Hospital, Enugu. She is the current president of the Association of Radiation and Clinical Oncologists in Nigeria, ACON, and a member of the Nigerian National Cancer Control Technical Working Group, and treasurer-elect, the African Organization of Research and Training in Cancer, IOTIC. Prof. Dr. Maka is also a global oncology leader and renowned researcher with over 20 years experience in clinical medicine, cancer care, and research, providing innovative solutions and coordinating programs with multi-donor founded organizations in public and private sector in sub-Saharan Africa. Good morning, Doc. I know that if I continue, I can continue to talk about you. So let's start the conversation.
Thank you for the kind introduction.
And it's nice to see you. See, one of the things I found is I have people on this, and most people I've never met before, and a lot of people don't know. So today, what's our topic about? Developing and fostering equity on cancer care in Nigeria. And the real thing that's coming up here is what's going to happen. And I want to talk about a particular a role that you guys play, especially when we talk about research in cancer care, because it's not really talked about in Nigeria, and ARCON, that's your association. And what is happening to us? We are the recipients of all the work you guys do. So let's go.
Sure.
What is ACON and what do you do?
Well, okay. So ACON, like you said, it's an acronym for Association of Radiation and Clinical Oncologists of Nigeria. This is actually a group of specialists who manage cancer patients. So we are trained in the use of using radiation and systemic agents to treat cancer. So essentially, what we do in Nigeria is to help patients who have cancer and just a few with benign lesions, that's not cancerous lesions. We treat them, and help them along their cancer care journey. So in a nutshell, that's essentially what we do. and who we are. We're not many in the country. We're about 93 radiation and clinical oncologists spread across Nigeria. So obviously, that is not nearly enough. But we are trying to see how we can use technology and leverage on some existing platforms to ensure that as many people that can are able to reach out and, benefit from the expertise of the subspecialty.
Oh, wow. Okay. And you've got research in your program. So, I like research. So I'm going to come back to you on this. I really like research as a survivor. So I'm going to come on that. That's very key for me. But let's go. So what has been the impact of your work on, or on the work of ARCON on changing the narrative for cancer patients? And let's look at it very objectively. I always say that I am in three different research programs, and it's very important that people understand the benefit of being part of research. So I don't want you to just focus on research, but I'm saying we're talking about changing the narrative for cancer patients in Nigeria.
I'm happy that you are really stressing the role of research in cancer care, and at ARCON we believe that not only should it contribute to cancer care, but we also hope that the research that we do will generate enough evidence and data to inform policy as well as the practice across board. So in terms of the impacts, we have 4 pillars really which we're running in ARCON, which is centered around patient care, really trying to use what we have, the skill set that is available to us as a country, the infrastructure that is available to us to try to push forward the needle a little bit, in terms of offering cancer care services that are in line with the global best standard of care, of course, evidence-based. Another area of focus, is research. So when you say that you're big on research, that is definitely something we are also big on. And like I said earlier, we believe at ARCON that it's not just doing research for just the sake of doing research, but research as a means to an end, research that impacts on patient care, research that impacts on quality of life of patients even while they're undergoing their treatment, research that ultimately gives the policymakers data that they can use to really define policies to impact all of us. So research, we're really big on research as well. And in fact, some of the programs we have lined up this year will really center around promoting research culture, research attitudes, not just in the mid-level and senior, but also the younger population, the resident doctors as well. And we are very happy to, with some of our partners who are partnering with us as we, move forward on that. Another area that we, in terms of what we do, is promoting education and training as well. So in terms of having highlighted some of these pillars, what is our impact? In terms of patient care now, we have partnered with the Ministry of Health to try to entrench the culture of multidisciplinary team management in the cancer patients. We know that, yes, we do see, our patient population is 98% cancer patients. So this is what we do. But we understand that we need the collaboration and expertise of other specialties involved. So having a multidisciplinary team management entrenched in the culture of treating cancer patients is something that we are part of and working very closely with the Ministry of Health to do as well. Another thing we have also been able to work with the Ministry of Health to do is to promote the uptake of evidence-based guidelines. 2 years ago, the Ministry of Health, through the National Cancer Control Program, adopted the NCC and harmonized guidelines for use for us in Nigeria. So we are at the forefront of helping to propagate that, because we do believe that it's important that patients are managed based off of standard of care. It does 2 things: improves outcomes, and yes, it actually reduces the cost of actually accessing these treatments, because now we are going to be offering treatments that have been proven to work. So it's not just doing, trial and error, wasting time, wasting resources and all of that. So again, like I said, research, we are also involved with that. And some of our members are hold very strategic positions in policy, in advocacy, so it's a multi-pronged approach that we require to be able to move the narrative forward. And we have members involved in various areas, that are moving this forward. NGOs, because you can't, the government can't do it all. Obviously, they need the help of partners. We have members in the academia. We have members who sit on key technical working groups and lend their voice and their expertise to the table so that decisions are shaped around, knowledge, as opposed to just taking decisions that probably would not really further the goal in terms of improving the narratives.
Okay, so now I know that we're going to be having your conference, the ALCON conference.
Yes.
In September the 11th to the 14th, am I right? In Enugu?
Yes.
I am right. So please talk us through it.
Okay, so the conference actually starts on the 10th to 14th, but the 10th and 11th are actually pre-conference workshops, so this is where we as a body come together and try to improve our expertise with treatment planning and all the works that goes into providing effective radiation therapy for patients, as well as, of course, systemic treatment. So the real conference itself starts on the 12th, all the way through to the 14th of September. This year, our theme is titled Equity in Oncology, looking at the perspective from the patients, policymakers, and of course, the practitioners. Now, the theme actually resonated from it was a fallout of the last year's conference where we had the launch of the Lancet Global Commission on Sub-Saharan Africa. Now, this all-important document consisted of over 54 experts across the world who came in to do a review of where we are in terms of cancer care, cancer services, the skill set, and the problems. Also looking at opportunities for improving cancer care on the continent. They came out with 8 resolutions, recommendations, and one of them is designing health systems for equity. So this is the one that we thought that we should start to get the conversation going. How do we ensure that even as we move the needle forward on cancer care in Nigeria, this does not leave anyone behind? So this is really the theme of this conference, getting everybody together and saying that, look, even as we are trying to improve cancer care, there's a subset of people that could potentially be left behind, which we don't want to. How do we ensure that somebody in Sokoto, somebody in Rivers State, and somebody in Kafanchan, stands to benefit from what is available in country, so that it's really not about living based on where you are, but really everybody gets some sort of opportunity to be able to fight the disease. We know it is not a walk in the park. We understand that even the recommendation put it as a 5-year mark, but we really think it's time to start getting the conversation going.
Awesome, because I believe I am very, I think that understanding the narrative of how we live and feel is essential. If you guys do these conferences and we're not there, so where are survivors in all of this, or what are we not just survivors, advocates as well? How do they play a part, or what is going to be their part in engaging in this? Because like you say, you're looking at it from the holistic, but there's also, you mentioned multidisciplinary, which is something I've made so much focus, made it a focus anytime we talk about cancer care, because I have benefited from it. So, and it's very good when you're talking about something that you understand, because then it makes other people recognize how it is important, that is a key thing. So now, advocates, NGOs, how are they going to be engaging in this program? Or how are you tailoring us into this program? Us as a me, even though
Yes, you definitely. We expect to see you there and a couple of other survivors as well, because honestly, we really can't do it without you in the room. You shape it, We understand it from the practitioner point of view. The advocates have their role to play, but ultimately, at the center of it all is the patient. So yes, we hope to see you. We hope to see quite a number of survivors as well, and in that program. So it's multidisciplinary. We hope to have stakeholders from across patients groups and survivors as well. We hope to have people from advocacy, the NGOs. We hope to have people from the private sector. They play a key role actually in really providing some of the infrastructure that we require to ensure that everybody has access. Of course, the policymakers as well, we hope to have all of this in the conference to get the discussions going. So in terms of who needs to be there, I'd say everybody really, but everybody who is involved with cancer care, everybody who has been affected by cancer, everybody who has a role to play, who has something to say. So yes, we have a lot of constraints, there are lots of challenges. But in that meeting, really, we're going to be exploring various opportunities to try to improve equitable distribution of cancer care services.
Thank you. Now, I'm going to go back to a question, and this is going back to still equity.
Sure.
Yeah, I love that word equity on this particular on this particular conversation. And the reason I'm picking on the word equity is because, like you've pointed out, to the equitable sharing in states, one of the biggest challenges I have continued to hear a lot of patients talk about, or survivors talk about, or is central when we're talking as advocates, is that the cost of care is high. And because it's very high, survivor is almost, a lot of people don't even bother coming to the hospital. And that narrative has to change if you guys are going to make a difference in getting people to you on time. Does that make sense? Because I'm really struggling. I mean, somebody reached out to me on this week that we've just gone through. And before we could finish, and I'll say, okay, let me try and find somebody to see what we can do, the person had gone. That means that it had been going on for long, but by the time even then, they'd lost the person, and the person had said, I don't even want the treatment, so I had to step back. But that is key if your work is going to make a big difference, because I'm going about research, and you've got to get the people to agree to do the research. I am in research. I wish people would just do it, because it gives you guys the data to do the work you've got to do. But that's a different conversation.
Yes, so I think that what you said is hitting the nail on the head. Obviously, everywhere in the world, cancer care is very expensive. How much more in Nigeria? So we understand that there needs to be some sort of financial support for patients who have cancer. We actually have a whole session looking at healthcare financing. We have the policymakers in that session. We have private sector. We have the patients to understand where the shoe really pinches. We have practitioners, and we have identified a few other key stakeholders that need to be in that session to have that discussion with. So we do have a session tailored to it. We had one that scratched the surface last year. So this year we want to take a deeper dive. And the reason we're very passionate about this is for two reasons. One, because we've seen that when the Cancer Health Fund, which was a brainchild of the NCCP, was was up and running, at my center, there was a surge in the number of patients who presented themselves to take up the care. So this is where having somebody pay for the cost of treatments definitely will improve outcomes. So we've seen it practical, real life. It's a problem that we see, that people are not able to, afford this drug. So we understand that if this elephant in the room is not talked about, we really can move forward as quickly as we hope to, in improving the narrative. But I must say that it's not all about healthcare financing. It's also the mindset. We also about education. We're a very religious group of people. I won't go into that, but it's not my portion syndrome and all of that. So education really needs to be at the forefront while we provide healthcare financing. And this is where I think patient survivors really come in, because it's hard for us. Sometimes it's a hard sell for members of the healthcare team. It's not just the doctors now. At my center, we have, and all other places, we have doctors, we have patient navigators, we have nurses who engage with the patients and try to walk them through and guide them that, oh, this at this time, and this is the right decision to take to be able to improve the outcome of your cancer. But, sometimes it does fall on deaf ears. But when we engage a survivor and have them dialogue with them one-on-one, it's like eureka, they understand, they see somebody who has had that lived experience and they can instantly relate. So I think at this point, I will say, while we are trying to do what we are trying to do, I think at this point, I know you're doing that very well, but again, it would be really helpful to develop a lot of patient advocates who can actually bridge the gap and help patients to come to terms with the decisions that are meted out to them that are being proposed, and then really take up these services when they are asked to.
Don't worry, we're working on it. We've been challenged. We're not working on it. We're working
Fantastic.
on it. We're getting there. So can you give all of us one thing we need to, firstly, why we need to engage and be part of the conversation, and one thing we need to, what we need to know to make sure we are there filling out the crowd. You give us 1 minute.
So
tell us what to do.
One thing you need to know, September 12th to 14th is the date. You really don't want to miss it. We implore you, we encourage you to please be part of it. We want this to not just be a conference as any other, but we actually are looking forward to meaningful impact following this conference. We expect that the outcomes from this conference will be able to at least set the pace for changing the narrative that we have right now in Nigeria.
And we will expect that the government will be sitting on this table with us, right?
Yes. One of the good things that has come out in terms of the cancer ecosystem is the establishment of the NICRAT, which is the Nigerian Institute of Cancer Research and Training. So everybody's expectant, and I know that NICRAT intends to be there personally, and we hope that we can continue to offer supports to NICRAT and, help to, as they develop their roadmap and work towards it. I mean, Akonites, all of us are really interested in ensuring that they succeed, because their success is ours. So NICRAT should be on the table during those conversations, and we hope that something meaningful will come out of it.
Thank you, Dr. Amaka, for a fantastic conversation. And I really hope that people will take up this offer and meet us there. This is Common Cancer Foundation. Follow us on our social media handles and hers. I will share it on our page so you can get anything you want from there, but you will see her all over our page by the end of the day. Common Cancer Foundation. Together we fight, together we win. We want you to be part of this. We want you to help us to change the narrative for cancer patients and cancer survivors across Nigeria. It's not an easy journey. Common Cancer Foundation, we have Instagram, Facebook, LinkedIn, Twitter, all over the place. I don't know. But let's help us to educate our family and friends in 2023 to make a difference. Dr. Amaka, it was lovely to be able to engage with you this morning. I'm telling you, it's awesome, because now I have some things to hold on. I always like to hold on to things. I'm going to come back at Christmas time when we have our special with AIT and review all the work that we've done. So thank you.
Thank you so much for having me, Denise. And again, we really appreciate the work you're doing. You play a vital role in shaping the narrative in the country. Thank you.
Thank you, AIT, for giving us this space. Thank you. We really appreciate you. Without you guys, we couldn't even have our space to be able to talk about this cancer. So, and to all of us viewers, we'll see you again in another 2 weeks when we'll be continuing this conversation on Kakaki cancer awareness. Thank you very much.